Good afternoon and welcome to the COVID-19 Learning Community, hosted by the COVID-19 Command Center and powered by the Joint Information Center. By default, all participants will be muted to minimize distractions. Please use the raise hand function at the bottom of your screen. When called on, please unmute your microphone to ask your question and remute your microphone when not speaking to minimize background noise. When speaking, please announce yourself and speak slowly. You can also enter your questions and comments into the chat panel. Please hold all questions and comments until after the presentation portion of the event. Our meeting objectives today are to review the current state of the SF pandemic and local indicators of hospital capacity, disease situation, and disease control and current pop-up testing efforts, to share updates on school reopening plans in San Francisco, and to explore how to create family-friendly COVID-19 testing through our pop-up efforts. Our agenda today is as follows, and I hand it over to Geoffrea Morris to continue the welcome.
Welcome, everybody. I'm excited to share today's agenda with you all. We have a really packed agenda, and I hope you all will be able to get some more insight of what we're doing and ask critical questions for us to kind of follow up and provide you all. So thank you.
Everybody, thank you again for the opportunity to present on our current COVID-19 status here in San Francisco, our response and testing update. I'm happy to see some blue skies today. I think we all are, based on compared to what the air quality has been over the past week. It's definitely a move to the positive for sure. Let me first give you an update on the number of cases. We have 10,569 cases in San Francisco, and we have documented 91 deaths here in the city.
Do you want to ask your question? Because I think Lonnie, who is my partner, Lonnie and Deanna, we are like a three-way trio, can answer your question. But Eileen, do you want to ask it on your own, or do you want me to read it?
Well, it's not really a question. It's just kind of a thought. What we have done before that has been really successful in reaching people experiencing homelessness is to have what we were calling encampment health fairs, and it was offering multiple different services. And I'm just wondering if a model like that could be adapted to include COVID testing and perhaps some other service.
Yeah.
So I have Lonnie, can you come out and speak? Because Lonnie been attending those meetings. I haven't. So
yeah. Hi, thank you, Geoffrea. And thank you for the question, Eileen. So I've just started to connect with the folks within DPH that are launching this effort. They've got the whole medical model and, doing this in partnership with federal grants that are going to help us push this out. So I'm still working through the nitty-gritty of that. But ideally, we want to be able to co-locate flu shots, and ideally, once we get to actually having a COVID vaccination, with testing events and the other community-like type events that we are doing around, that we're doing right now through our district neighborhood action plans. So the short answer is yes. The longer answer is we have to figure out how to do that co-location. What is the right type of outreach for the specific communities? How do we solicit advice? And then projecting what the turnout would be so we have enough, we make sure we have enough materials for each site. So we're at the beginning stages of that, but I think it should be a partnership and be co-located with the other things that are happening at the community level. One of the challenges with this, I'll just throw this out there, is the majority of San Franciscans have health insurance, and so we don't want to make it so broadly available to where everybody is coming to get it for free. and it's actually getting to the communities that truly need it, that can't access it through whatever, due to not having a health provider or other challenges. So, you know, we want to, like, at the same time, encourage all the folks with, like myself, you know, I have health insurance through my job. I'm going to get the flu shot there. So we're working through those items right now.
Thank you, Lonnie. And Joy, to answer your question, it has not launched, but it is a conversation, and it may even happen in October, but it is a conversation, and we'll continue to put an update on this for Fridays. And I want us to be mindful of time. So, because we have a speaker about school reopening, and I know this is a hot and sexy topic. So, Jonathan, can you introduce our speaker, please?
It'd be my pleasure. Thank you. And thank you all for that great feedback. So Anna Validzic is for the School Hub, leads school and childcare efforts, and has been an incredible leader through COVID Command, working with a number of important partners and stakeholders. So Anna, thank you so much for joining us. We'll build on the presentation that we had last week, focused specifically on community hubs. That was presented by DCYF. And so, Anna, thank you for joining us, and look forward to hearing your talk.
Oh, thank you, Jonathan. And let's just say that teamwork makes the dream work. So there's a lot of people working on this. So thank you for the opportunity to speak. I just want to make sure, can anybody see the slides and hear me?
Yes, we can. Thank you.
Okay, great. So I'm here obviously to talk about the safer reopening of schools in San Francisco, and the items that we're presenting. Some of them actually overlap with the community hubs, and I will point that out as we move forward in the presentation. And please ignore the date on the bottom. It's actually updated last week, but I just forgot to change the date, so sorry. So in order to have a safer reopening of schools, it is one of the top priorities of the mayor is a reopening plan. And we want to make sure that we do this as safely as possible. So that we need to have some minimum health and safety standards in place in order to bring teachers and staff and students back through TK through grade 12 schools. The data and science has shown that it is only appropriate to consider reopening schools when there are lower rates of community transmission, where the city and county of San Francisco is right now. So that is why we are deciding to move forward. In order to ground us in that data and science, we did establish some baseline criteria to help us understand our gating criteria for deciding to move forward with schools. And the two main sources of criteria are one from the state and two from our own key public health indicators. So on the state, we have switched from the watch list to the tiered system, as Jonathan had referenced earlier. And according to the state, if any county is in the red tier or below, we can move forward with a full school reopening, and that includes elementary, middle, and high schools. If we were on the watch list or the purple tier, a county can only move forward through a waiver process for elementary schools only, but we are now permitted to consider all schools. On top of that, we have chosen 3 key public health indicators to gauge where we are in San Francisco, and that is making sure that our cases are stable and declining, our hospitalizations are stable and declining, and the test positivity rate is under 3%, which is where we are right now. So in order to move forward with the safer reopening of schools, we have to follow some guidance that we can offer to all the schools when they consider their plans. We've developed a guidance that was published on August 10th, and this is based on the state guidance as well as what we know from research and best practices. And there are some measures that are specific to schools and some that are universal. And so the ones that are specific to schools, and I'm going to apologize, there is one that I have neglected to add, is that we are recommending routine asymptomatic testing for all teachers and staff. And this is also in recommendation for the community hubs. And that has to be done universally for prior to school opening. So all teachers and staff have to be tested. And then the state requires that the teachers and staff get tested over a 2-month period. So it can be 25% of the staff every 2 weeks or 50% of the staff every month. But as long as everyone gets tested every 2 months, just to make sure that we are capturing everybody. Other school-wide measures include daily symptom screenings. We want this to be as rigorous as possible. So if anyone is experiencing any symptoms, they are sent home. Creating small, stable cohorts within schools. This is to basically creating almost mini households within the classroom so that in the event of an exposure or a confirmed case, we can contain the spread of the virus to as small as a group as possible, minimizing the amount of movement within a school, the specialized staff training and family education that needs to happen. What are the triggers for switching to distance learning in the event that a pod needs to quarantine, or if there is an outbreak that is severe enough where one has to consider a school closure? What would be some of those triggers? And then school communication plans. And then there are other measures that we see in every other area that's opening up. So making sure that there's routine cleaning and disinfection, that everyone is wearing face coverings, that everyone is washing hands, and that there's hand sanitizer available. Making sure that there's enough soap in the schools and enough cleaning supplies that people have the opportunity to be able to wash their hands. Making sure we do close contact and case investigation, making sure there's physical distancing. This is pretty important, especially for the staff. We want to make sure that the staff is always 6 feet apart because we're just as concerned about staff safety or adult safety. Often people just focus on the students, but we know that this is an adult to adult transmission virus. And so we want to make sure that considerations are taken in for the staff. And of course, symptomatic close contact testing for students and staff, similar to what we do right now. So in order for us to have a safer reopening of schools, we're going to have to go from the picture on the left, which is the infamous picture of a high school in Georgia a couple of months ago, to the picture on the right. And this is what it would take to make sure that we have safe and successful learning in schools. Just a quick overview of our timeline for school reopening, and this is an ambitious goal, but we're working very hard to make this happen. In July 16th, San Francisco was placed on the watch list. And on July 17th, the state released guidance for schools, including tying it to the watch list and creating this waiver process for elementary schools. So since we were put on the watch list, we then, COVID Command pivoted toward creating a waiver process for elementary schools, and we spent the rest of July and August working on that. And the day we launched the waiver process is the same day that the state switched from a watch list to a tiered system, placing San Francisco in the red and therefore bypassing the waiver process for us and allowing us to move forward with middle and high schools as well. But since we had done all that work, in September, we are looking at all these schools that had submitted an application process, keeping in mind that the San Francisco Unified School District has announced that they are going to continue remote learning. This process is open to them, but they haven't submitted an application yet. We are moving forward with the applications that we do have from charter, parochial, and private schools, and we are reviewing them and which is a two-step process, and approving them on a rolling basis as long as they have appropriate safety measures in place. And then in October, we will be accepting applications from other schools that did not apply for the waiver process. And then in November, we will look at high schools because of all the educational settings. High schools is possibly the riskiest because there's enough evidence to show that teenagers contract, transmit, and suffer symptoms of COVID just like adults. And a quick overview of our review process. It's a two-step process where we have a review of the desktop applications, and we have a review team working on that. And then we also have created an in-person site assessment process where we've assembled a team of people and have trained them and developed a survey, and they're literally going out to school sites and making sure they have the measures in place that they have said, because this is a place where these teachers and staff and these students are going to be going on a regular basis, and we want to make sure it's as safe as possible. Any school that will be approved to open will only be approved to open in a staggered return, starting with kindergarten through second grades first, because the research shows that children under 10 don't transmit this virus as much or don't have as many symptoms, and yet it is the hardest for this age group to do distance learning. So that is the way we will be approaching school reopening. Oh, I'm sorry, I forgot a pretty critical piece was that considering equity measures for school reopening, we are soliciting information from schools on their equity measures. And so the percent of schools with free and reduced price meals or the percent of financial aid they offer will be taken into consideration for school reopening. And the larger the percentage, they will get a higher priority for reopening as we move forward with the applications. But in the meantime, we do know that school is closed and that families and students need some support with distance learning. So we created a program called Out of School Time. Well, we created guidance called Out of School Time, which allows other programs for youth. And this is where the community hubs, the guidance for the community hubs lies in, both for the ones that are supported by the city, but also the private ones that are being run by after-school providers, including other measures like recreation and care and other youth sports, which is pretty minimal at this point. Per the state, no competition, no scrimmaging, just basically physical conditioning with 6 feet apart outside with pretty limited sharing of equipment. Moving on. And to get ready for the education field and the back to school time, the COVID command and particularly the information and guidance section has been working extremely hard over the summer to be publishing guidance, and with the city attorney's office publishing health directives and health orders. So there have been updates to the health order related to education. We also published a directive and guidance on higher ed. There's stuff for out of school, which I just mentioned, also childcare providers and reopening of schools. And there is a tip sheet for families who are self-organizing their own pods to be able to support and provide some safety tips in the event if someone's doing it in their own home. And then there are other supporting documents for health checks for children. And there's a quick guide for if they're in the event that there's an exposure or case. And there's also if there's contact tracing. There is another directive that was published a few days ago, allowing schools to open to support targeted specialized services. And this is fully an equity measure for schools. There are certain groups of students that just are not doing well at all with distance learning. And the state has now published guidance that we have codified in San Francisco This is particularly aimed at students with disabilities, either physical disabilities or learning disabilities that are not doing very well with distance learning, as well as those that are living in housing insecurity or food insecurity and are struggling to bridge the digital divide. Schools are now allowed to support those. And my understanding is that the school district will be presenting some preliminary plans to their own Board of Ed this coming Tuesday to be talking about in-person instruction and including this very important equity measure in their presentation. I don't know many details, but I encourage everybody to be tuning in this coming Tuesday. And all of our guidance can be found on this website that's in this white box here. Internally, as we prepare for school reopening, we have convened a task force within COVID Command to make sure that we have the proper structures in place and to be ready for schools, so that we're not a hindrance, we're actually a support. So we've spent a record amount of time creating a project charter on how we will support the reopening of the prevention, and also this spans to the community hubs. What are some of our prevention and mitigation measures? These preventative site assessments that I described earlier as part of the review process for school reopening is one of these preventative measures, because we find that if we can make sure that the prevention measures are put into place prior, we will have less opportunity for clusters and outbreaks to occur, as well as making sure we have constant connections and communication with all of the schools and the community hubs. We talk pretty frequently with DCYF, the Department of Children, Youth, and Families, as well as we have a weekly meeting with the school district and the parochial private and charter schools. We will be establishing regular channels of communication so that we can provide technical assistance and support when there are cases. We are focusing our efforts on priority populations, areas, and schools. So for the community hubs, this Safer Schools Reopening Task Force will support primary support districts 6, 9, 10, and 11. Whereas with schools, because we have citywide school assignment, we will be looking at the % of free and reduced lunch and or the % of financial aid, and help stand up those schools with more support. Of course, there's testing, both the routine asymptomatic testing or the surveillance testing, as well as symptomatic and close contact testing, and making sure that, again, focused mostly on the teachers and staff, making sure that there is surveillance testing, and then there's enough resources for symptomatic and close contact for the entire school population. And with just making sure we have contact tracing, case investigation, outbreak management support, and then making sure that we are evaluating our efforts so we know that we can institute some quality improvement all along the way. And that is it for me. So I'm open to any comments or questions, and thank you very much for the opportunity to present.
Thank you so much, Anna. And I'm just gonna call people and you can read your own questions. So it'll be going through the chat, and anyone that wants to add on to asking questions, you can just throw your name in the chat and say, Geoffrea, call me next, or put your hand up, but I'm gonna go through the chat first as priority. So Mike, can you, Monica, then Mike. So Monica, you have a question?
Yes, hi, good afternoon, everyone. I believe you kind of answered it during the presentation, but it was about how the negotiations are going with UCSF or UESF and SIU regarding potential reopenings for SFUSD. And then it was answered about an MOU, et cetera. So if you could just clarify on if there is any potential adjustment in their timeline of when they think they would open up the public schools.
That is an excellent question, and I'm not sure I'm the right person to be answering that. I know the school district is in labor negotiations and they are continuing to move them forward. I am not sure. I've never been privy to the status of the labor negotiations. I know they are continuing conversations, but again, the Chronicle actually posted an article today saying that the school district will be presenting on Tuesday with some of their preliminary plans for instruction learning. And it seems like as long as the labor negotiations go well, there might be some opportunity for small populations to come back in January of 2021. But again, that is just a news article in a paper, and I think we'll all find out a lot more on Tuesday at the Board of Ed hearing.
Thank you. Mike?
If I could comment on that really fast too. My understanding is also that even faculty was not able to access schools until very recently with the mayor's recent press release along with DPH. And so right now teachers are able to actually access schools. I think their biggest priority right now is figuring out the special education class kids and those with IEPs as opposed to actual hybrid learning. The hybrid learning is going to come after there's been 14 days of no COVID cases. That was the big stickler in the negotiations between SFUSD and the SF Teachers Union. I guess the curious question for me is knowing that SFUSD holds, I think, 130 some odd schools. Does each school need to turn in a reopening plan or guideline of sorts? Or do they submit it to like SFUSD and SFUSD submits one big one? Like, are we in a situation where all the schools open at the same time? Or are we in a situation where school by school it might open?
Per the state guidance, which we've adopted, the superintendent is allowed to put forward an application on behalf of the district, but then there has to be a reopening plan for each individual school. And we would want to see plans for all the schools and how they're being implemented, and probably do site assessments at every single school so that we can assess whether the prevention measures, including the state of the building, is safe enough to bring the student population and the staff back. And so that means if the school district is moving forward with their reopening plans, we at COVID Command need to move in order to be able to support them. But we need to see what is announced on Tuesday at the Board of Ed in order to adequately prepare.
Thank you. And now, LaMonica.
Hi, everybody. So my question is kind of in reference to the list and around the safety considerations for monitoring students and staff as they're arriving at the schools for symptoms, and the fact that it just hits right in the heart of flu season. Is there a more detailed plan of what would trigger schools re-shutting down during this time? Because it's going to be right in the middle of flu season, if it happens.
Yes, that's an excellent point. And it is in the middle of flu season, and there are a number of the symptoms that overlap. Until somebody gets tested, we don't really know. So the symptom screening will encompass the standard list of pediatric symptoms as recommended by the state. But we will be encouraging everyone to go get tested. And if there is guidelines to return back to school is if someone receives a negative test. But if you have the flu, one should also stay home as much as possible. But the other thing I want to address about school closure is, hold on one second. Milo, I'm talking. I'll be right back. Okay, I'm sorry, that was my son. The school closures is that the reason why we're creating these small stable cohorts is that in the event of a possible exposure or a confirmed case, we only have to close the cohort, and therefore we don't have to close the whole school. And that is how we plan on mitigating the spread. And if there are multiple cohorts that are impacted, that's when we would consider a full school closure. So we don't have to go back to what we experienced in the spring, where if there was just one or two cases, the whole school shut down. We are approaching it in a different way, but it requires the establishment of these cohorts in order to do that safely.
And I think this is so, I'm gonna call on Joy next, and then Jennifer, and then we're gonna conclude. But I think it's so indicative that your son, and we talking about school closures, because I mean, I think a lot of us, that's our life right now, of trying to work homeschool and everything. Tiffany,
you know it.
Tiffany, I laughed because she called herself the principal today. So Joy, come on in.
Thank you, Geoffrea. So you were talking about how the task force could support the community hubs, and I think I missed how so, like, how does a hub reach out? Are you going to help with testing the hub staff, or like how does that work in terms of support?
That's a really good question. I'm actually going to see if we can bring Jonathan in for that as well. We are definitely working very closely with the hubs, not only in terms of all the mitigation measures that they have to put in place. We've been meeting with DCYF repeatedly over the course of the summer to talk about the information and guidance, but also then a lot of the support. So we are working on the testing strategies, and also working with Kaiser, particularly because not only for the hubs, but also for the school district. A vast majority of staff is covered by Kaiser. So encouraging everyone to get their test through their primary care provider. I'm told right now Kaiser has approximate space for approximately 500 tests a day, and they're only getting 250 appointments. So we would like to encourage everyone to go to their PCP first, but then there is support from our city services to provide testing for the hub. And I believe Supervisor Ronan had added, I think, $1 million add back to the budget to specifically for testing for the hub. Jonathan, is there anything else to add to that?
Sure, no, great. And Joy, thanks so much for the question. I would add to that we, because of the requirements that Anna shared, that all staff should have testing before they come into work. And then with the periodicity that she mentioned, 25% every 2 weeks, 50% every month, and all staff every 2 months. That can happen for folks to go to their primary care providers if they have them, and if not, we have a number of the sites, for example, City Test SF, where they'll be able to access testing, our ATS sites, and our pop-up sites. So all of those are going to be available for staff to be able to access those. And in just a moment, we'll talk a little bit more about for families and to encourage family testing and how we could use our existing infrastructure to really encourage families to come, not just the kids coming before they start school and periodically while they're in, part of the hubs, but also for their parents and other family members to get tested, because that's where another potential concern or a key safety measure is to ensure that the families are being tested, because if their parents are positive, then potentially transmitting to their kids and then coming into the hub. So one prevention strategy is to encourage families to get tested. So we'll talk more about that in just a moment.
Yes, so Jennifer, you're next, and we are concluded after you, so that we can talk about family testing.
Yes, I think they just answered my question in terms of how the schools can coordinate testing for faculty and staff, if that was through DPH or we should send them to their primary care physician. So it sounds like there's both options are, primary care first, testing through the city afterwards.
If I may expand on that just a little bit, we're definitely encouraging teachers and staff to go to their primary care provider first, and those schools that charge tuition, we are actually asking them to either encourage their staff to go to the PCP, or they establish their own contract with a private testing lab, and not to burden our city resources with testing, so that we can free up space for other efforts like the community hubs. And I neglected to say another way we are supporting the community hubs is particularly with the outbreak management group. They have making sure that we're keeping a close eye on any possible exposures and cases, so that if there is a cluster forming, we can respond very quickly and make sure that we can prevent an outbreak. So that is another way we're supporting the hubs. And that's it for me. Thank you.
Thank you so much, Anna. We truly appreciate it. And these slides will go out to you all. Thank you. Now back to you, Jonathan.
Great, and thank you. Just to continue the conversation we were having about trying to create family-friendly testing. So if you can actually in the chat, we'd love your ideas. So what are some of the things that we can do to try to help make all of our testing sites that we have at our disposal to be family-friendly? So those are the community pop-up sites, as well as our alternative testing sites at Southeast, Potrero, Maxine Hall, Castro Missions, ESFG. Like, we want to try to make sure that they are attractive and supportive of families coming to get tested. So we'd love to hear more about that. And then the other question we have is one of the sites that we've had at our disposal, it's a state asset, is the Optum serve sites. And so they require an indoor testing site. So and given that many of the community hubs are based in the southeast part of the city, particularly in D10, we were thinking, would love your thoughts on sites that we should consider in general, large sites like gymnasiums, but well-ventilated sites where testing can happen, and particularly that could be family friendly. So if you could just take a moment, brainstorm a little bit. If you could put these into the chat, that would be great. Just, I know we're limited in time, but take some time, think about family-friendly sites. How do we make our testing sites family-friendly, and specifically indoor sites that you think we should be exploring? So just take a moment now and we'll track the chat. And while you're putting those ideas down, I'll also say that our ATS sites currently test children, and we are at the precipice right now. We have approval from city attorneys. We'll be able to test children under the age of 13 at our color sites shortly, and we'll be working very closely with color over the next week around trying to start piloting for younger children under the age of 13. Currently at the color sites, 13 and over without parental consent is approved, and we'll be finalizing plans so that the youngest kids can start getting tested there. So other ideas about places and other things that we could offer as part of our testing, the testing site to make them family friendly. Timing, other things we should offer, location, etc. Keep the ideas coming.
And it is 2 o'clock. I put my email in the chat for those of you that don't have it. So you can continue to email me when you have an idea of this. I love Oracle, especially when they're not playing. And then so did Dr. Fuchs. And thank you all. Have a great weekend. We don't have, we'll be sending the agenda out on Wednesday to do about next week's topics. It's so many moving parts. But yeah, thanks Anna for joining in the community learning too.
Great.
So yeah, and I would say that the Cow Palace is really unique. It is San Mateo County, but I think we do have board members from the city and county. So I'll look into that as well, Joy. Thanks, everybody.
Great, thank you so much. Take care.
Thank you for joining the COVID-19 Learning Community event. Questions or needs, please contact equity-neighborhoods@sfgov.org.